considering genetic screening when couples go through fertility treatments like in vitro fertilization may assist, particularly when a couple's had recurrent miscarriages. And you're saying, I want to avoid a miscarriage if possible. However, we can't fix a problem if we identify it. We may be able to exclude an embryo. And with the hope of having a healthy baby, and by screening embryos, we're hoping to have at least one embryo that comes back with a normal result. But what is not emphasized enough is that sometimes if we screen 3 or 4 embryos, sometimes none of the embryos are normal in result, and we have no embryo to put back. So we may have avoided a miscarriage occurring again, but we haven't assured they're going to have a baby. And that's the kibosh. We don't know of a way to repair a problem that we see. We can have more eggs at one time to have more events to hopefully, if the chance of success is lower, to find the one winner. But we don't know how to fix the problem. And where this hype comes up is that there's additional cost to genetic screening. And if a couple only had one, or a woman only had one embryo, it is the one. And to do more manipulation is unlikely to harm the embryo in our technology now. But it won't fix it. It can add expense. If you don't have many embryos from which to select one, then why not just put that embryo back? Which means that preimplantation genetic screening really isn't for everyone. And many centers will do it for everyone, almost like if you need a car to go to work. Well, I need a Honda Accord, but I want it with a pinstriping and a tail fin. Well, you don't need that to go to work. So some people in our field presume that by offering these higher technologies, things will be better. But in fact, they'll be the same for many folks. And so preimplantation genetic testing isn't for everybody. It could add expense. And in the balance of things, the additional cost may prevent someone from having a new group of eggs and sperm where they might have had a better chance by a second round of IVF than putting all their expenses into a single cycle for everything. So I advise my patients this way. I advise folks out there this way. If there are a large number of embryos, let's say 4, 5, or 6 to test, and we see maybe 50% of embryos in general for a woman under age 40, 50% of embryos will come back with a normal genetic result. And if you had 4, 5, 6 embryos, maybe 3 may have a normal result. And we're not putting all embryos back at once. The whole idea is one at a time, because a healthy baby and a healthy mama is the point. We know the greatest risks with IVF therapy come in multiple gestation, too many babies at once, preterm delivery, and all the problems and strains on mothers and babies from that. So we want to avoid that, and genetic screening may help us to hone in on the winner. So if there are a large number of embryos, then maybe genetic screening has a cost-benefit analysis to the benefit side, because it would avoid us with additional cycles of embryos that may not be normal. If we can sort out the 5 or 6 to the 2 or 3 that are normal, less embryo transfers is less cost for unsuccessful embryo transfers, and that can offset the cost of genetic screening, and that makes more sense. So recurrent pregnancy losses, women who are in their 40s, the screening may be worthwhile to do out of the gates. For younger folks, probably not so, unless they have so many embryos and you're trying to sort out which ones really have a chance. Then we can quit playing the shell game and hone in on